Hello, my name is Mikey Hannon, and today I'm going to be performing tracheostomy care and tracheostomy suctioning. So first things first, we got tracheostomy suctioning. We always want to verify the order, first and foremost. Then after that, we always want to maintain standard precautions. That's basically the precautions that we provide to all patients, regardless. And then we always want to do hand hygiene before we start anything. And then when walking in the room, we want to automatically introduce ourselves using AIDIT. And by introducing ourselves, we acknowledge the patient, we introduce ourselves, we talk about the duration of the procedure, and then we explain what we're doing, then we always give thanks. And then after that, we want to identify the patient using two identifiers. This would be like name and like date of birth, and then as well as checking their wristband just to make sure we have the right patient. Then we want to provide privacy with the patient. That'd be like moving the curtains over to make sure no one else can see. Then we want to explain what we're doing, so we'll be performing tracheostomy suctioning in this. And then after that, we want to place the patient in semi-Fowler's position. Then we would open up our kit and then place the linen saver pad or a towel on top of the patient's chest. Next, we would go to the wall and turn on the wall suctioning or the portable suctioning machine and adjust the pressure regulator according to the agency's policy. Then after that, we would don non-sterile gloves or in a face shield or goggles. And then we want to test the suctioning equipment by occluding the connection tubing by putting our thumb over the port. After that, we would remove and discard the non-sterile gloves and perform hand hygiene. Next, we would open the suction catheter kit or the gathered supplies if a kit is not available. And then we would place out our sterile field onto our area. We would then don sterile gloves, considering the dominant hand sterile and the non-dominant hand non-sterile. Next, we would pour the sterile saline into a sterile container using the non-dominant hand. Pre-measure the catheter insertion distance for 0.5 to 1 centimeter past the distal end of the endotracheal tube. The endotracheal tube normally sits between the 3rd and 7th centimeter above the carina. Remove gloves and perform hand hygiene, then don sterile gloves. Pick up the suctioning catheter with the dominant hand and attach it to the connection tubing. Keep dominant hand sterile. Put the tip of the suction catheter into the sterile container of the normal saline solution and suction a small amount of normal saline solution through the catheter, and then apply suction by placing a finger over the suction control port of the suction catheter. If the patient is receiving supplement oxygen, hyperoxygenate according to agency policy. Patients requiring mechanical ventilation, press the 100% O2 button on the ventilator or attach the resuscitation bag to the endotracheal tube or tracheostomy tube and manually hyperoxygenate the patient according to agency policy. Remove the resuscitation bag and places it next to the patient when finished. Patient not requiring mechanical ventilation, obtain help from an assistant, ask the assistant to attach the resuscitation bag to the tracheostomy or endotracheal tube, hyperoxygenate the patient by compressing the resuscitation tube 3 or 5 times, remove the resuscitation bag and place it next to the patient when finished. Lubricate the suction catheter tip with normal saline. Using the dominant hand, gently but quickly insert the suction catheter into the endotracheal tube or tracheostomy tube. Advance the suction catheter with the suction off, gently aiming downward and being careful not to force the catheter. Insert to the pre-measured length, not more than 15 centimeters. Apply the suctioning while withdrawing the catheter and rotating the catheter while withdrawing, and make sure not to apply suctioning for longer than 15 seconds. Repeat the suctioning as needed, allowing at least 30-second intervals between suctioning. Make sure to hyperoxygenate the patient between each pass, and then limit the total suctioning time to around 5 minutes. Coil the suction catheter in the dominant hand, wrapping it around the dominant hand, and then pull the sterile glove off over the coiled catheter. Replace the oxygen source if the patient was removed from the source during the suctioning, and discard the glove and catheter in water-resistant receptacle designated by the agency. Using the non-dominant hand, clear the connecting tube of secretions by placing the tip into the container of sterile saline. Next, we have tracheostomy care. First and foremost, we want to verify the provider ordering care plan. We want to maintain standard precaution, which is the universal precaution provided to every single patient. We want to perform hand hygiene when it is indicated. Then, when entering the room, we want to introduce ourselves. We do this by using AIDIT. AIDIT is acknowledging the patient, introducing yourself, talking about how long you're going to be there or the duration, explaining what you're doing, and thanking the patient for their time. Next, provide patient privacy. We do this by moving the curtains over. You want to identify the patient using 2 identifiers. For example, it would be like the patient's name and date of birth, and then you also want to double check with their wristband to make sure we have the right patient. Next, you want to explain the procedure to the patient, family, or caregiver, which in this case, it is tracheostomy care. You want to position the patient in semi-Fowlers. And lastly, you want to assess the vital signs and patient status before the procedure even begins, and then place the BMV nearby. You want to remove the tracheostomy dressing and discard it, and assess the tracheostomy site. It is important to assess the site so there's no damage or skin breakdown or maybe a wound forming. We do this to promote patient safety, that way there doesn't get infected, and to overall provide better care for the patient. Next, we remove and dispose of gloves and perform hand hygiene. Next, we want to prepare our sterile field by placing out our mat. And make sure to apply your sterile gloves and perform a proper technique. Remove the inner cannula as needed with clean hand. Then, clean the inner cannula as needed, maintaining a clean hand and sterile hand. You also want to make sure to give ample time for the inner cannula to air dry before inserting it back into the tube. Once it has completely air dried, insert a new or cleaned and dry inner cannula. We want to clean the tracheostomy site, including the face plate, the outer cannula, and surrounding areas. You want to remove the old tube holder. And again, we want to assess the skin to make sure there's no damage, there's no skin breakdown, or there's no like sign of infection, because we want to make sure that that area doesn't get infected, making our patient more worse off. After removing the old tube holder and assessing the area and skin, we want to change the new with a new tube holder and ensure the security of it. You want to make sure that the new tube holder is tight, but not too tight, and you should be able to fit 2 fingers under there. We also want to make sure that it's secure, that way the tube doesn't move out of place or anything like that. After ensuring the security of the new tube holder, apply gauze pads as needed. After performing a thorough trach care, just like how we assess the vital signs and patient status before the procedure, we also want to assess the vital signs and patient status after the procedure as well. After that, we want to return the bed to the lowest position with the side rails up. We want to place the call light within reach. We want to dispose of any PPE and used equipment in the proper storage bins or proper disposable containers according to agency policy. We want to perform hand hygiene, and we want to assess for additional needs of the client, and we also want to state the expected return of when we're going to be back in with the client. And then lastly but not least, you want to make sure you document. You want to document the date, the time, the assessment, the procedure, and the patient's response to the procedure.